Thank you, DJ, Yuki, and also Nori. Next will be the panel discussion on the topic of building and nurturing healthy community alliance. I would like to introduce our moderator, Angela Tang. Angela Tang is the Chief Executive Officer of Richmond Area Multi Services. Also is a subcontractor under Public Health Institute for the Lotus project. Welcome, Angela.
Hi, everyone. Good afternoon. Okay, we're in the almost the home stretch, but this really, I feel like this next section really just rounds out all the wonderful conversations we've been having in the beginning, starting from we have assessments, and we had really about the ACEs and a lot of other kind of barriers to treatment. I think now we're talking about the next segment is really about building community and coalitions. I'd like to invite our panelists to come up, or if you want to come up one at a time, that's good too. Okay. So we'll go in order that we have listed. First, do you have slides too? Oh, okay. Oh, okay, okay. Okay, so for now, I'm going to first introduce Amira Abdulhafid. She is the program director for suicide prevention at GUIDE. Amir serves as the program director. She joined GUIDE in June of 2019. Amira focuses on increasing awareness and resources for suicide prevention, including evidence-based suicide prevention training, such as the Question, Persuade, Refer, which is QPR, and Youth Mental Health First Aid. She received her Bachelor's of Arts in Spanish with a creative writing minor at Georgia College and State University, and earned a Master's in Public Health at Georgia State University. Amira is passionate about building relationships and sharing knowledge and education to create a healthier community.
Or start from that way. All right. Hi, everybody. Thank you. And talking about culturally diverse. So you saw that my bachelor's was in Spanish, but I'm actually Arab. So it's culturally, talk about just the cultural diversity there. But thank you, Jen. Thank you. My counterpart there. All right, so as was mentioned in my introduction, I'm the program director for suicide prevention, and we were started by a partnership alliance, actually. So I'm going to give you a little bit of background about GUIDE if you're not familiar with this, and then talk about our building partnerships and alliances with the work that we do. Let's see if I can make this thing work. All right. So GUIDE, essentially, our vision is on the screen, but it is I don't know why I gave this to you. I need it. I can't read that. To improve community conditions by utilizing collaborations, promoting positive youth development, and delivering specialized trainings and resources in prevention and preventing substance use and abuse. This was written before we started into the mental health suicide prevention avenue. But the logo's there, and you can kind of see what each picture kind of stands for. And it was essentially a combination between the Board of Education and the Board of Commissioners in Gwinnett County that decided, hey, we need to be proactive with this. Let's start an agency. So GUIDE was eventually formed from an alliance with the two entities there. And we've stuck around since 1986, which is pretty good for a nonprofit. But we do a lot of different work, but part of our biggest collaboration is our coalition that we manage, which is the prevention. See, this is going to look familiar because it was in Yoki's. But it is the Prevention Action Collaborative of Gwinnett, or PAC-G. This is a coalition. We have, I want to say, 20 organizations or more that we all kind of come together. And as a whole group, we meet once a month, but then we have different task force, which you can see on the slide as well. But basically, our vision is a drug-free community in Gwinnett that's mentally, physically, and emotionally healthy. So because we know, and we've heard about it all day, that physical health and mental health and just overall health is all combined. It's not just one or the other. You can't have one without the other, vice versa. And this is the first time we get to use our logo, so there we go. But we have different work groups according to what we are trying to accomplish. So we invite many different community partners, different agencies, different organizations to come together. We have a discussion like, this is why we want to partner with you. This is why it's important and why it'll benefit you, why it'll benefit us, and how we can make it kind of like a cohesive effort within the community. We also have a youth advisory board. We can't be a youth development agency without the voice of our youth. And I think that is one of our strongest aspects is the fact that we have a youth advisory board that provides input in our messaging when it comes to prevention messages. They attend our monthly board of directors meetings and they report. And a lot of them, this year's group is the biggest we've had since I've been hired. Anyway, we've got about 20 youth from different high schools in Gwinnett County, and they're very culturally diverse. So which also plays into a lot of our prevention messages there. I can't remember what I have next. And this was kind of like a quote that we used to spin off the coalition. But never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. I can't read today. But this was kind of like the basis. This is when we started PAC-G in 2019, it was something that we wanted to do for the longest. When I was hired in 2019 as the Suicide Prevention Program Coordinator, now Director. But part of our deliverable for the grant, which I have to shout out DBHDD, Department of Behavioral Health Developmental Disabilities, because we have the funding from them to be able to do this work. But part of the deliverables were to create a coalition, an organization like alliance, to be able to combat the work. Gwinnett had one. It was disbanded when we started getting the grant. So we had to build it from the bottom up. And it started off small, and we decided, hey, we know that mental health includes physical health, and we also have other strategies for substance use prevention. And we know that people go to substances for coping strategies when they're dealing with a mental health challenge. So why not try to combine it? So that is kind of where PAC-G came out of. It started off as an advisory board where, hey, we have the funding, we want to do this, but we want to get your input. Now it's more of a coalition where we're trying to get more active involvement with our organizations, with our alliances that are part of it. And we have grown substantially, exponentially in the past 5 years, I believe, 4 years. So like I said, we have about 20 organizations overall that have a representative that meet. We partner a lot with the police department, fire department, different cultural agencies. Viewpoint Health is one of them. The Children's Healthcare of America is one of them, and we just a lot of different. And then Jen is and the Catalyst Coalition is one of the newest organizations that we are partnering with, and I'm really excited for that because one of our big deliverables is reaching into those underserved populations, and Gwinnett is one of the most diverse counties in the state of Georgia with a high population of Korean Vietnamese. I believe somebody was focusing on those two just because it was one of the two. So all of our materials we try to get translated into all of those, but we need the input from that community as well. So we try to bring everybody to the table to help us with our project. So hopefully that gives you a little bit of insight on our alliance building workshop, and I'm going to pass it to the next person.
Thank you. So for our next part is Jennifer Wilds. So we'll do a little swap.
Switch.
So Jennifer has worked with Viewpoint Health since 2007 and is involved with multiple professional affiliations, including multiple local interagency planning teams, local suicide prevention coalitions, drug-free community coalitions, and family connection partnerships. She is a certified trainer for Question, Persuade, and Refer, QPR, and suicide prevention, and youth mental health first aid, and is an advocate for youth and families on personal, country, and state levels. Thank you.
Thank you. So yes, Jennifer Wilds, Viewpoint Health. So Yuki and I work. Did I have to use this? Can you hear me right? So Yuki and I work together quite a bit. So thank you so much, Jen, for having me today. I don't know where he went. There he is, he's hiding back there. Thank you. So Viewpoint Health is, we're one of 22 agencies throughout the state of Georgia who is supported through Department of Behavioral Health and Developmental Disabilities, like Yuki said, to provide supports for those who are uninsured or have a form of Medicaid and so otherwise are ineligible for private insurance. And so our mission really is to promote the overall health and improve quality of life by ensuring delivery of effective behavioral and physical health care that really meets the needs of the communities that we serve. And so we're really, really intentional about that. Let's see if I can do this the right way. Ah, look at that. So I put a lot of words up here, but all of this is really, I wanted to make you all see 1 in 5 adults in America experiences a mental illness. 50% of all lifetime mental illness begins by the age of 14 and 75% by the age of 24. All of these other things, right? People with serious mental illness are booked into jails. People with depression have a higher level of physical health needs, right? Mental illness have no insurance, people have no insurance coverage, right? So all of these other things that are impacted when people don't get the mental health coverage and treatment that they need. Suicide rates go up, right? Substance abuse comorbidities, dropout rates, right? So this is affecting our entire communities when people are not getting the mental health treatment that they need. And so Viewpoint Health, we have a whole range, a whole continuum of services that's available, and so I'm gonna go through a couple of those. But again, really wanting to meet the holistic needs of the individuals in our communities. Look, I'm trying to be in the right place so you can see too. We have 5 outpatient centers in Gwinnett, Rockdale, and Newton counties. Lawrenceville, Covington, Conyers, and we have actually 2 here in Norcross. One is a bilingual center with Spanish. Spanish bilingual, but a full range of mental health services for adults and youth. Okay, therapy, training, resources, and we've got pharmacies that we partner with as well. This is just some of our outpatient services that are available in those outpatient centers. So outpatient centers is like, you know, typical walking into a behavioral health center. I need help, right? Getting that one-on-one therapy, diagnostic evaluations like he was talking about, nursing assessments, things like that. So pretty basic services for those who may have a low level of need. I thought it was really interesting that the gentleman was talking about people might not come in for mental health, right? We got to be listening to what the need really is and those underlying needs, because they might not be ready to talk about that yet, but they are ready to talk about the challenge that they're having, right? So this is Apex. This is Yuki's program that she just spoke about. We have about 40 schools, and so you know, really making sure that we're hitting kids at all different levels of intervention and need. We do stuff that's at the school, at the whole school level or the district level, and then a little bit more by supporting our school staff, and then really that one-on-one support for individuals that really need it. This is our 5 clubhouse programs. We're very, very excited about our 5 clubhouse programs. 4 of them are here in Gwinnett County. We have 4 that are bilingual Spanish. And so we've got mental health resiliency clubhouses, substance abuse prevention clubhouses, and substance abuse recovery clubhouses. So a little bit different ages. I just wanted to show you our phenomenal new flyer that we have. So, and again, these are all supported through Department of Behavioral Health and Developmental Disabilities. And so we've got a lot of services. We've got a lot of supports for a lot of people. And so I'm not going to read all of this to you, but you know, we do a lot out in our communities with peer support, with individuals that have multiple hospitalizations. We have a program for those to make sure that they get connected to what they need. Case management skills to get people connected. Residential programs. We've got this assertive community treatment is a high intensity. People that are in and out of the hospitals, in and out of jails, facing homelessness with high level of severe and persistent mental illness. That's like a 6 or 8 member team that goes out into the community and finds these people. That includes doctors, that includes supported employment, that includes housing specialists, that includes therapists and nurses, right? They all go out into the community to meet the needs. Project Light is a first episode psychosis program. So if somebody's had their first episode of psychosis within the last 24 months, they can get involved, because there's a lot of different needs that come along when you start to experience psychosis when you're a young person, right? So making sure we're meeting those needs. Co-responder programs are one of our newer programs. It's probably 4 maybe years old now, 3 years old? 3 years old maybe. Really, really amazing. We have partnerships with several law enforcement agencies. We have clinicians that go out with law enforcement into the communities whenever there's a call that comes in that they think maybe of behavioral health in nature. They go out together. The goal is to try to divert people from unnecessarily going to detention facilities, right? Getting them the mental health treatment that they need. We have day programs for mental health, for intellectual and developmental disabilities. We have residential programs, independent living, semi-independent living. We've got family support services for those who have developmental disabilities, and also residential services. We have an intensive in community for young people. I told you we have an adult one. We have one for young people as well. High level of needs, kids who are suicidal, homicidal, at risk of harm to self or others. We've got some housing. It's hard to talk about housing because the funding changes sometimes. But you know, we try to help support individuals who are in the hospitals, or are coming out of the hospitals, or are in hotels. Right? How do we get people moved in long-term situations? And so we try to do that as well. Another one of our newer programs is a detox center. Okay, that's located in Covington, but we also have a 28-day inpatient program. We've got substance abuse residential programs. We've got medication-assisted treatment now, and lots and lots and lots for substance abuse. We have 3 crisis stabilization units. One's for adults here in Gwinnett County. Covers the state, but is located here in Gwinnett County. We have an adolescent crisis stabilization unit for mental health, and we have a young person crisis stabilization unit for individuals with autism. Free trainings in youth mental health first aid and QPR. You can have Amira and I come anytime you like to your organization, your faith community, your whatever you have. We'd love to come out and talk to students as well. So we're happy to do that. Our locations nearby are in Lawrenceville and Georgia Bell Court. Those are our main offices. I didn't put the Spanish bilingual on there because they're about to move, and so I didn't know the new address. So, but we do have multiple programs in the Gwinnett County area. Woo. Well, I heard that too. So, no, I did hear that too. So, but I don't know if that's confirmed yet. Yeah. So, I think we have several programs that may be coming into this building, including one of those bilingual clubhouses. So, yeah, we've got several new programs that's the discussion is this building. So, thank you.
Thank you. I mean, it sounds like even just being in the same location, that there's lots of opportunity to even like bolster up the community like connectedness and alliance. I wanted to introduce Doha, who is the organizing manager at the Asian American Advocacy Fund. Doha is an Afro-Arab community organizer raised in Greensboro, North Carolina. Her work spans multiple industries and geographies with people and strategy at the core. She has worked at the Centers for Disease Control and Prevention, the CDC, providing technical assistance for community health coalitions. Currently, Doha is the organizing manager and believes in community as a means towards liberation for immigrant communities in the South.
Hi, everyone. I'm here, obviously not as a mental health professional or anyone who even really works super closely specifically with mental health. However, I'm here to talk about collaboration and to really offer an invitation for any of you all who are interested in working with the Asian American Advocacy Fund or other advocacy, specifically API advocacy organizations, to connect with us. And I did want to share just some of our collaborations just within the past year, both to give you all an idea of the kinds of collaborations that we do, because we really believe that creativity should always be at the core of collaboration as well as culture. And if you all are not familiar with Asian American Advocacy Fund, we are actually a political organization. If you all are aware of Asian Americans Advancing Justice Atlanta, they are a C3 nonprofit, and we are their C4 offshoot, which basically means that we take political stances. We have an endorsement committee, we have a membership program, and we advocate for the civil and human rights of Asian Americans as well as all Asian immigrants, as well as BIPOC, POC, which is Black, Indigenous people of color, and for their rights to live with dignity in the state of Georgia and across the country. And so without further ado, I'll share a little bit about the collaborations that we do. And this is in the style of Spotify Wrapped, which I don't know if y'all are familiar with that, but our comms team is pretty fancy. So they put this together. So our political team, the collaborations that they were able to be a part of was that they revamped a values-based endorsement program that had 10 members of our organization involved. And then they also worked alongside partners to stop IRA and anti-immigrant property right bills. And IRA is a definition of anti-Semitism that affects like the First Amendment and like freedom of speech. And so I share the political collaborations to, again, have an offering for if you all within your organizations have any kind of like legislation or want to ever advocate at the state capitol or to testify, this is an opportunity for you all who have the lived experiences to come and share with us who might not have the lived experiences, but also are not seeing, you know, maybe mental health cases day to day. We always try to work with people who are the closest and most proximal to an issue. And that's, you know, some collaborations that they were part of. And then here they've listed their top collaborators. So they worked with a student organization, they worked with an endorsement committee, phone bankers and canvassers, and they worked with Emory APITA, which is an activism organization. So I believe it stands for Asian American Pacific Islander Activists Association, and then a political fellow. And then these are the places that their work took them, which was the Georgia State Capitol, North Carolina, and Nashville. And then one thing that they wanted to bring into 2024 was their team and building on victories. My team, which is the organizing team, one of our collaborations, one of our like proudest collaborations, I think, was building up a framework and structure for our membership program. And something that we hear a lot actually in the Georgia area is that there's not a lot of people who are super interested in politics who identify as Asian, but they are really interested in making social connections. And so I think that, you know, even with meeting Jen and getting involved with Catalyst Coalition, it allowed me the opportunity not only to learn about the work that Jen does, but even his invitation to me and to connect was an opportunity to then bring that to our members. And some of our members are here today because of us, you know, leveraging our relationships and bringing folks here. And then I would say the second thing was building a relationship with community members and other organizers through attending community events and conferences. And so this is another thing where I think you all can really take advantage of organizations like ours because we do need a lot of the input that you all have because we can't be everywhere. But at the same time, if we're talking to each other and we're collaborating, we can learn from each other. And so that's something that's extremely important. And then these were our kind of top collaborators. Claire Tran, who is a organizer, and our members, some university students, national groups, GAR, which is Grassroots Asians Rising, and then 18 Million Rising, which is a AAPI digital organizing group, and then some local groups, specifically including the Stop Cop City movement. Our work took us to Los Angeles, California, Georgia Tech's campus, and Duluth Town Center. And I'll just flag that Duluth Town Center, we actually had a AAPI artisan market, makers market, where we invited makers to come and share their wares. And then we actually did a lot of storytelling. We invited a lot of those folks to share, why they are interested in arts. And a lot of the stories that they shared were about not only being able to create art, but also to showcase their culture, and that being kind of like an outlet for them. So that was really cool. And we want to bring more members and get them more involved into our work. And then lastly is the communications team. Their collaborations were firstly Threads of Justice. They worked with 25 plus Asian American creatives to execute this project. And that specifically, Threads of Justice, was each artist was given a jean jacket. And with that jean jacket, they, tore it up, added thread to it, designed it, and a lot of them really used their culture to really affect the jean jacket. It was really cool, and a lot of those artists were. All of those artists were based in Georgia, but a lot of those artists participated in our storytelling project, where I would say the largest theme of that was not feeling like they belonged in the United States, and how art was an outlet for them that wasn't necessarily one that their families really celebrated or saw as anything more than a hobby. And there were 25 different artists, and I would say each one of them almost cited art as a form of therapy and as a form of outlet for them. And so I think creating spaces like that where people can see, where someone, even if you're not Asian American, can see Asian Americans being empowered through their creative expression, I think that offers really a lot of insight, and it's something that we should be proud of that we're doing here in the Georgia community. And then we have an Artivism lab, which is art and activism blended together. And there's a mural that Christina Kwan put in our artist, and there's an upcoming art installation that is happening. And then these are again, some more collaborators, and I will say all of these collaborations were literally all of them were people that we connected with through going to community events, and really just talking to people. And I think that aspect of all of our work, at Advocacy Fund, that cannot be understated. And so I'm offering these kind of examples to you all as opportunities, but at the same time, I think it's really important as you think about community collaborations or even just community spaces, to know that not everyone is going to know about your work, and the only way you can share about your work and help people sometimes is to talk to others. And so again, this me being here is an invitation to help in terms of how we can better collaborate, how we can, uplift the work that you all are doing within the mental health space, and bring it to people, whether it's through advocacy, whether it's through cultural organizing and, artistic expression, or something else. So yeah, that's all I have. Thank you.
Thank you so much. So I'm gonna, I get the privilege to be asking a few questions, and then we're gonna open it up to the audience. So if you have questions, we'll circle back on that. So the first question that we have is, what do you think is a good first step to support collaboration with other organizations?
I can start, and then whoever else. So that's I feel like that's what I was just kind of talking about. I think the first step is to just reach out, and also to just really learn about what the community is doing. And I would say, especially for the AAPI community, I think there are lots of events that are happening, but oftentimes
She took my answer.
Oh, really? Yeah, like, but a lot of times they're, you just have to show up. And I think that that's something that can't be undervalued.
Yeah, no, and just having conversations with people that you may not even have thought about collaborating with in the past. Because we all do have similarities in our passions, in our dreams, in our hopes for a better community. And so I think just having those conversations and being real about it, and being willing to put yourself out there a little bit.
And I'm just gonna say ditto. But no, I think both of them exactly. I have the same agreements, and I have wrote some stuff down. But just have that conversation, talk to people. If you ever see me at an event, I'm never at one place. I think I drive probably Jennifer crazy when I'm at events with her because I never stay in one place, and I'm always connecting with who can I meet now and who can I partner with, because that's how we grow our alliances and our work. And just find that common ground, and kind of see like, hey, okay, well, you offer this, I offer this. I was talking to Doha just yesterday. I'm like, hey, you're in advocacy. There's an advocacy day next week at the Capitol. We probably need to talk about that. So it's just building those relationships, having those conversations, and just putting yourself out there, really.
So related to that, what do you think are some of the challenges and successes around having a collaboration or a coalition?
For what I'm saying, at least particularly with some of our coalition members and this and that, going from just an advisory board to a coalition where the advisory board, it was guides project, we were going to do this, we just don't want input, whereas a coalition, we all kind of are putting in our different resources together to come together as one. Gesundheit, as they say in German. And everyone I talk to is like, oh, that's a really great cause, you're doing great work, which is, yes, it's great, and everyone is doing great work, but I need some action behind the words. So some of that has been very challenging for me personally.
In terms of challenges, I would also say sometimes you have to really be clear about what it is that you need from the collaboration and like what your goals are, because you don't want to create more work for yourself. And a lot of folks here are like in nonprofits or in academia, and so I know that there's always a lot that you want to do with very little. And so I think in keeping with like your own mental health, and as well as like the health of your organization, if there isn't a really strategic alignment with working together, and if we aren't able to be very clear about what we need, then maybe we don't need to work with each other. Maybe we can support each other in other ways. Maybe we can uplift our work in other ways. It doesn't always have to be collaboration in like one specific way.
Yeah, and finding just to piggyback on that, finding the place where that person feels their niche, right? It may be coming to a meeting once a month and reporting the information back to their organization. It may be going out to a community event and learning about the other organizations within the community and telling people about your organization. It may be, you're going down to the Capitol and doing advocacy. So finding where their niche is, where their strengths are, and where they think that they could be most helpful. Yeah, because I agree. I was thinking as you were talking to Doha that Amira and I had this conversation, I think last week. Like, we have these collaborative meetings, and she runs one and I run one. But at the end of the meeting, like, who's got all the action items? Like, we've got all the action items. So it's like at the end of it, we have to be very clear. To your point, we've got to be really clear about, okay, I need you to do this and you to do, because this is a collaboration. This isn't the Jennifer show, the Jennifer Coalition. Right? It's the collaborative coalition. So I think being really clear about that. But I think one of the hugest benefits, I always say, because I do a lot of meetings with families, with community providers at the table, and I think that there's a lot of value in having those conversations that, I can talk to a family all day and have one or two or three ideas, but I think that the value is in that conversation. I heard a quote many years ago that was something about the ideas that would never have been created without these people in the room, right? So it's not, I can't be alone in creating all of these wonderful opportunities and ideas and passions, but those ideas that can be generated when people are feeding on each other and believing in each other and wanting to grow together for the betterment of a purpose and a passion, I think is really powerful.
Thank you for that. Kind of following up on it, Dua, you kind of mentioned it too, a little bit about how I feel like we all choose to really be in this work, to be in the community work. And there's a lot of collaboration that we want to do, and sometimes it's about capacity. So how did your organizations build that capacity to have like a community liaison kind of idea?
Yuki and I have the best supervisor in the entire world. I will just tell you that. I'll stack him up against anybody. This is a man that, so I've worked at Viewpoint Health since 2007. He's been my supervisor since 2007, except for a very brief period of time that didn't go well. So we switched that around really quick. But so we have about 600 and something employees at Viewpoint Health. So he's not the only one that's amazing, but I'll just speak from my perspective on that is, he's this person that can see 2 years ahead, right? He can see the tea leaves and see what the state focus might be in a couple of years from now. He sees, you know, the contributions of staff and where they could be plugged in the best way possible. And I think it's really, and growing people to their strengths. And I think noticing, I mean, our team was the one that started this co-responder model out of, you know, hearing about it maybe in other parts of the country. You know, we were one of the first ones here in Georgia, and we now have several. You know, just really being visionary and really putting people in the right places. And just, he always says, let's find the yes. Right? So, you know, where all these other programs, they've got your criteria. Well, do they meet this criteria? Do they meet this criteria? Check, check, check. He started this no silo team so that anybody in the agency has any of the people that we serve has a need. We pull together people from different departments that may not otherwise know what each other is doing, pull them together for the betterment of this one individual today. Right? And we're going to pull them together as often as we need to. So I just think being really creative, wanting to find the yes in everything, and really, like I said, being really visionary, putting people in there where their strengths are. Yeah. That's what I can think of off the top of my head.
I find your question really hard to answer solely because my organization, our funding is like very different, but however, like we are, you know, specifically doing community organization and you know, like community building. And so I would say that in terms of like capacity, something that we typically try to ask ourselves is, who are we like not talking to? And because of that, we are often thinking about reaching out to organizations like the organizations that you all work with. But at the same time, I think it's really important to always be asking yourself that question. I love what you said about like the no siloing project, like that. I'm going to think about that because I think that sometimes we do tend to silo ourselves. So I feel like your question is like a really good like challenge for me to be thinking about a little more.
And I just kind of piggyback. I had a topic and I forgot it. But capacity is a real thing. It's in everybody. My saying for the past couple of years has been, the world is understaffed and overworked at the moment. So when we were kind of reinventing our coalition, PAC-G, when we did a whole new kickoff event in September last year, we're like, okay, maybe you don't have the capacity to come, but maybe send a representative, or just send me the emails and I'll send in the input. And so we've kind of made it a little flexible where if they don't have the capacity, they can still contribute to the cause, to the meeting. And then part of the sustainability factor for a lot of our projects, because a lot of our funding is around sustainability, because funding is never guaranteed when you're a nonprofit. So how are we going to continue these QPR trainings or youth mental health first aid trainings? And so we're working with different organizations and saying, hey, we're in the same space. how about we work together and collaborate and say, okay, I can get somebody trained as an instructor in your organization, and you can continue doing the trainings even when we can't do it, for example. And that's been really successful, where we've grown our capacity with trainers, which just in the county of 1 million residents, it just allows us to reach more people. And thankfully, one of our trainings has just been translated to Korean, and I'm not sure whether it's Mandarin or Cantonese. They just say Chinese, so I'm not sure which one it is. But I'm hoping that I can find some partners in that, so we can bring that to this particular community, because it is important. So that's kind of, we think about sustainability, like, okay, who else is working in the same space? How can we kind of work, like, because Guide can't do it all. For example, Amira cannot be everywhere when she works in 3 different counties. So who else can we pull to the table for that?
No, thank you for that. I mean, that it sounds like there's being intentional about the partnerships where things can be complementary, being intentional, and also like funding does. There is funding for advocacy and community coalition building. So I mean, those are already like ways for us to all think about how to build capacity. My next question is about what kinds of intersector agency partnerships would you say are the most important to build to better support the mental health needs of Asian American, Asian immigrant communities in Atlanta? What might be an ideal system look like?
I think for all communities, we need to do a better job in getting into the faith-based world, and that's not specific to AAPI, but just in general, some of the cultural dynamics of faith-based communities have been difficult to kind of integrate into. So I think, and parents, always parents, making sure they're at the table, like Amira said. She does a lot of work with the Youth Action Board here, and we both do a lot of work with the Youth Action team that's in Rockdale County and Newton County. So getting the youth, I think the youth are so willing to talk about things like this a lot of times when their parents or grandparents don't know how to have those conversations, but the youth are doing a good job of it, so we really need to include them.
I think also going on your point, I completely agree about the faith-based aspect, and I also think that there's something with the youth around. I'm like smiling as I say this because I feel like an imposter saying this, but I think that like there is a huge facet of the communities that people create for themselves and like family that people create for themselves that's outside of their, biological family. And I'm smiling as I say that because I'm thinking about my younger sibling, my brother, who we are his only family, right? Like we are his only social he only interacts with us, right? He's like teenager. He only interacts with our family. I don't know if he has friends. I don't know. But then I have my eldest brother, who family isn't that big of a deal to him, but he has his like friend group who are like his family, right? And so I think that there are opportunities there for like, membership programs that people are a part of, fraternities, sororities, like things that might not necessarily be, faith or might not be biological family, but are still so meaningful for people. And I think, trying to create partnerships with those kinds of groups could also be like an avenue, especially because, like the nuclear family versus like extended family, like that might not always be the best way to like reach someone. And so I think there's lots of alternatives.
And also adding in the Public Health Prevention Coalition building, where there's this thing called 12 community sectors that we need to have at the table. And I can't list all 12. But Google is our friend, so if you want to know the 12. But the 2 that we're missing in ours, like for example, are the faith-based community, some parents as well. There's people on our coalition that serve in both roles, but we may need somebody to fit in this one particular role and not the other, and it's a challenge. And when we come to the cultural competency, if we're trying to reach out to an underserved population or a particular, we need agencies that serve that culture. I could go to the Gwinnett Police as a thing, but they might not have something that is specific for AAPI community, for example. And I don't know anything about the AAPI community. I couldn't tell you too much about, well, a little bit about the Arab because my husband's from Egypt. That's different. But when I was learning it, it was still very new. And part of my deliverables for my grant is getting into those underserved populations. But I don't know the challenges of mental health and API. Now I do, thanks to Jen and over research and everything else, which is why I attended. And a lot of it, as I was talking to Graydon earlier, there's a lot of similarities with the Hispanic culture. I can tell you all about that all day long. And there's some similarities to it. And I saw that with my brother with his mental health challenge and his older father and family, that generation gap that we were talking about earlier. But I think we need agencies that cater to those particular populations because that would help because they know what would might work. I know, for example, with an HIV awareness or an HIV research thing I was doing on master's, there was a group that they really wanted to raise HIV awareness among Hispanics, but sexual education is a huge topic in a population. It's a taboo topic. You just don't talk about it. So what do? They infiltrate through soccer because soccer is huge in that culture. And so we need to find, and I know that was mentioned earlier with the tea and other, you had a wonderful word for it, the cultural artifacts, I believe. And I think we need to get more awareness about that and use that to our advantage to learn more about the culture and have these conversations in a way that it's not so blatantly in your face, having that mental health discussion without talking about mental health, so to speak.
Well, I was thinking when you were talking too, thinking about who is best to kind of be that person, right? And so Amira was talking about getting people trained in different communities, even to speaking about law enforcement, right? If we get somebody trained in law enforcement, that's going to be way different than me walking into a police department, right, and trying to teach them about youth mental health first aid or QPR for suicide prevention. If they have somebody that they already know that's in their what's the word I'm looking for? Right, in their repertoire, in their
Culture.
lexicon was the word I was looking for, right? Is that the right word? I don't know if that's the right word.
And I could go do a QPR for an AAPI thing, but I'm not in the AAPI population. So who better would it be to have somebody in that particular culture, right?
No, thank you. I mean, I'm thinking about like the cultural artifacts, the cultural settings that might naturally happen, like the soccer practices, the faith-based gatherings that may happen on certain days. Even schools can be seen as like a natural setting where a lot of outreach can be happening.
Those relationships and that trust, right? We
Right.
really got to build that trust.
Yeah, and having, like you said, someone in the police department example, having maybe someone who they recognize and that kind of trust broker to help foster the relationship. What do you think different organizations serving ethnically and racially marginalized communities can learn from each other? What kinds of resources can be shared?
We can learn every day, all day, every day.
I really liked the slide earlier about the cultural humility piece. And so I'm going to steal that answer because I think that like learning about each other's cultures, I think is so important. And something that actually came out of like a group in North Carolina, it's called SEAC Village, which is like Southeast Asian. You're nodding your head, but I don't know what SEAC stands for. So if you know, please share. Southeast Asian Coalition, yes, thank you so much. And they actually work with, specifically started working with Southeast Asian youth, but they realized that the Southeast Asian youth for the after-school programming would come and bring their Black friends. And they were prepared for, trainings and activities specifically that centered Southeast Asians. But then a whole bunch of Black students came and wanted to be part of it. And so then they actually ended up shifting their coalition and shifting, their work and saying, Black and Southeast Asian because of, the networking, because of the natural, authentic relationships that were there, right? And so I think of that example very often because unfortunately we don't talk to each other and we don't naturally engage with people of another culture outside of school. And statistics show that you all are super smart people. There was a popular book that was it was titled why all the Black kids sit in the cafeteria together kind of thing. And so I think the cultural humility piece can't be stated less, or whatever the phrase is. I think it's really, really important that we talk to each other and that we work with each other across, within multiracial kind of coalitions, and being very intentional about that too.
I would have to ask you to repeat the question again because I was so engaged in what she was saying.
I probably didn't even answer the question.
I don't know what the question is any longer. I'm sorry. Do you know the answer to the question?
When in doubt, give it to the person in the middle. All right. Question: what do you think different agencies serving marginalized communities can learn from each other? That's kind of like a shorter version of it, but yes. I think everything that Doha said was spot on, really. Just learn. There. That's my answer. Maybe about different resources. For example, one of the reasons why I did want to come for the whole day was I'm rebuilding a brochure for suicide prevention, and I need to have resources for the AAPI community because I don't have any. So learn from different agencies. What are some different resources? So I've got the piece. There was another one that I've written down that I do have written down. So when I build this resource out and I get it translated, then I can guide them to people that they might be more comfortable with speaking. So just learn from each other about, okay, I didn't know about this resource, but thank you. So now I can add it to and help my community as well.
And I think all of that builds that respect and that trust, right? If we really are intentional, and I really did try to find out how to best deliver this information to you. And I think language goes a really long way in that as well. We talk a lot about person-centered language. I don't know if y'all touched on that today at all, but people are not their diagnoses, right? They're not schizophrenic, they're not bipolar, they're not autistic, right? Just like they're not cancerous, right? So being really intentional about it's a person with schizophrenia, a person with, bipolar disorder, I think makes a big difference because it really changes the way people see themselves and the way other community members see them. I heard somebody recently talking about, he was standing up, he was introducing himself, I'm a convicted felon. And he said, no, wait a minute. I'm a person who's been convicted of felonies, right? Imagine if that was you and you label yourself as a convicted felon, and now all of a sudden, that's not your identity. That's one part of you, right? And so I think that's really important that we're not, that we take that out, right? That labeling of an entire individual by the worst day of their life, right? Take that out of the equation. And just like you're left-handed, I got bipolar disorder, right? So.
Thank you. We now wanted to open it up to the audience. We have probably have time for 2 questions.
We answered them all.
Yes.
So I think it's easy to reach out to people who are interested, right? But we need to reach out to who are indifferent to whatever you're trying to. So what are some things that you try to kind of cultivate the interest in those who are not interested?
Well, in the suicide prevention world, we hear it a lot. Oh, it's not going to happen to us. It doesn't happen to us. That kind of thing. And then that you know of is my response. I can't really say that typically in work settings, but you might not think it does, but it does happen around you. And so just educating them, like, okay, I understand that you believe it's not going to happen to you or anything like that, but did you also know that there's 25 attempts of a suicide after one documented death? And that could easily be an extended family member or just a friend, a colleague, a business member, that kind of thing. And just kind of sharing that education. It might not make a difference, but at least you're sharing some education about it. And really that's kind of been my go-to. It's like, okay, I'm going to at least give you a little tidbit to think about. Like, it might not happen to your nuclear family, but it could happen to your neighbor, which is going to spill into your yard. That kind of thing.
Yeah, along those lines, I think I say sometimes it's not pertinent to someone until it's personal, right? And we've had a couple of suicides recently that have touched communities that did not expect it at all. And so now they're starting to pay attention. And I think reaching out to places where we might not otherwise, like I talked last night and one day last week to women who do hair, right? We've got to get into those places where women who are cutting hair, the person sitting in the chair is da 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 da, and so they hear a lot of stuff, right? So finding those ways in, where they might not be ready to go to a parent support group, but hey, if the lady that does my hair that I trust, that I've been going to for 6 years, that I sit in this chair for 2 hours, every time I get my hair done, if she's recommending this parent support group and she's going and she's putting resources out there and she's putting the flyer up on her window, maybe I ought to give it a try. So here, again, building those relationships and that trust, right? We got to get that trust before people will open up.
Any other questions from the audience? Okay. Well, I think we'll also have opportunity to do a breakout session after, but want to give a last round of appreciation and applause for our panel.